Now, the main advances in surgical treatment are the development of less invasive techniques, which is really easier on the patient, and it's honestly convinced not more than a few patients that this is an option. So traditionally, if you needed epilepsy surgery, you had a craniotomy, skull's removed, brain's opened up. The surgeon will operate on the area where the seizures are coming from, and hopefully there won't be any deficits afterward. But there's a recovery period. One of the newer advances is laser ablation. So there's a technique where the surgeon can put the patient in the operating room, and there's a three-dimensional representation of the brain using real-time MRI. The surgeon can insert a catheter, so it's just a small hole in the skull. It's not opening up the whole brain, and they know exactly where they're going. They can avoid the blood vessels. They can have a very good chance of not causing a problem, go directly to where we've determined hopefully the seizures are coming from, and using a laser just destroy that part of the brain. You know, as neurologists, we feel like brain is a good thing, so you don't want to take more out than you absolutely have to. What we don't know yet is whether that's definitely going to be as effective as the traditional surgery. You know, traditional surgery in the best cases can cure up to 70–80% of people, meaning they'll still need to be on drugs, so I shouldn't say cure, but they won't have any more seizures. With this technique, there's much more limited information. The initial results of published trials suggest it's in the same ballpark, but that's something that we're still going to get more comfort with as we go forward. Well, you have to remember that surgery is almost never subject to clinical trials. It's just not possible to do, what we do with drug therapy, where you have randomized placebo-controlled trials. Now you can't really do placebo surgery. So you can't subject people to the same standard when you talk about the efficacy of any surgical treatment. And that even goes for the traditional surgery. So we have to go at it sort of indirectly and through experience. And like I said, we have an idea of the success rate of traditional surgery. Indirectly, we hope we can compare this and find out it's at least as good. But are we doing it now? Yes. I mean, honestly, if it were my brain, I would rather start with a less invasive technique that takes out less brain. Worst case scenario, you can still go back and do the traditional surgery if it doesn't work.